spot. Alright, today is August the 7th, 2024, and Dr. Rose and I are going to go over how to open and read a cone beam CT. So, you know how to open Romexis? Alright, so there's a link at the top in the chart. There's a bridge link that says Romexis. You can look on your computer. So go to chart. Up at the top it says Romexis. You see it? Right there.
Okay, gotcha.
Yep, that'll get you into Romexis. Okay. So once you're in there, you have file, we'll show you all their files. 2D, we'll show you their 2D files, which there's not a ton of 2D files, but sometimes you take screenshots. And then 3D will bring you into their 3D. Most likely you're going to have a 10 by 10, which is 10 centimeters tall by 10 centimeters wide. The tall are going to be flat planes. The wide, it will be a 10 centimeter circle. Okay, so it'll look like a cylinder.
Okay.
The goal when the team is capturing, which would be good for you to at least have someone show you how to capture one. There are red lights. One of them marks the front of the 10 by 10 or the range. So if you're doing a 10 by 10, it's going to be just in front of the teeth, which typically is on the lips, and then there's a midline. So we'll show you that. So you just click on the one you want. It says 3D. Exposure date is right here, and then 10 by 10 centimeters. Does that make sense?
Yes.
Alrighty. So this is the view that it's going to bring you into. You are actually, I'm gonna see if I'm gonna move this up just a little and just blur her name out in the recording because I want you to be able to see up here. So in this viewer, you're in the Explorer view. So the Explorer view is going to have 4 windows. One is a coronal view, which is the green. So if you click down here, it turns on the coronal plane.
Okay.
So this plane is this view.
Okay.
This one would be the sagittal. Yeah, speak up, you're on camera.
Sagittal.
That's right. So your sagittal is going to be, or on audio. So the sagittal is going to be, remember your mid-sagittal cut in Cadaver Lab? Yep. So that's right down the middle, which is going to look like this.
Okay.
And then that would leave what plane? One more
The
plane.
axial.
Right. So axial. So we'll turn on the axial. And so the blue one is this one.
Okay.
Okay? So they look like this. So when I'll just leave these colors on so we can see them moving. So if we want to evaluate in the coronal view, we can slide right here. And as we're sliding through the slices, you can see on the lower right the green plane moving. You can see those are the lips on the bite block there. And then you can see the green plane moving here and here.
Okay, so you don't have to click on one of the views. You just click on that.
Well, you can click on them. You can also left click and drag them around like this.
Okay.
And then you can right click and rotate.
Okay.
Okay. So this is the patient's right. This is the anterior, posterior, patient's right. So if you were to imagine how they're sitting, the scan is like this. So when you're scrolling up, this is their right. It's as if you were standing at their feet and they're laying on their back.
Okay.
That's how the views are as far as the axial. And then the coronal, obviously, is like you're looking straight at them. And then this view would be like looking, I believe, at their left side.
Okay.
Let's see if that holds true. So this would be the far side. Actually, it looks like they'd be laying on there. It's like you're looking at them from the right. That makes sense?
Yeah.
Okay, but anyway, so those are the views. You can just go right here and click Reset Orientation. Any of these that you float over, it gives you a name. Like this one is, let's see, Move, Rotate, Volume. This big cursor makes it hard sometimes. toggle zoom mode for mouse scroll wheel. Alright, so this is a good general view. So when you hit reset, it looks like it doesn't move. This one.
Mm-hmm.
Okay. Now, this patients will say, they'll look and say, "Ooh, that looks scary." You know, I usually will say something like, "Well, that's what we all look like on the inside," or "We'll all look like that one day."
Okay.
Anyway, people will say that. So if you want, so if you want to try to clean up the 3D image, you just grab this bar right here, which is the set 3D rendering cutoff threshold.
Mm-hmm.
So she's got nice dense bone and healthy teeth.
Mm-hmm.
So we just slide it this way and it gets pretty clean.
Okay.
You know, there's not really a hole here, it's just less dense.
Mm-hmm.
You know, there's not holes here, it's just less dense. And you know, what's the most dense thing?
The mandible.
That's right, the mandible and then the teeth. So you're right, here's the mandible, but then the last thing's the teeth and, the enamel. That makes sense, right? So the enamel is the most dense outside of restorations.
So what's the purpose of doing that for that view?
Sometimes, like if you have a periapical lesion
Mm-hmm.
with a perforation of the bone, you'll be able to demonstrate that to the patient. If you have a bony defect, you can show them that. If you're trying to show them the mental foramen, sometimes if you're looking like at the incisive canal, just to look at it. If the scan goes far enough back, you can see the lingula and where the nerve goes into the mandible. Like right here, you can see right there.
Yeah.
So this is good if you're trying to visualize where you're trying to give your injection.
Mm-hmm.
You know, you could measure on your scan how far it is from this cusp to back here and visualize that angle. You can see like the target would be right here, and it's really on her going to be right on the occlusal plane. Does that make sense?
Yeah. Mm-hmm.
You know, and then here's where you're trying to get around the spot right here. So when you hit here, you know you're short, and then it's like drops back another few millimeters or 5 or 6 millimeters to get to here. Does that make sense?
Yes. Mm-hmm.
Great. So, all right. So if you're just normal, healthy patient and you're trying to evaluate them, you can go to Explorer View and go to the coronal view and just start in the front and just start scrolling like this. In here, right now I'm looking at the sinuses. They look clear. Her septum looks straight. We don't do a lot of, that doesn't affect a lot of what we do, but it does. This would be like your osteomeatal complex here, you know, where your maxillary sinus connects to your nasal sinus. So there's cilia in here beating all together to clear mucus out of the maxillary sinus. But if you're placing implants in the sinus, you're doing a sinus graft, you do want to make sure you have a patent osteomeatal complex. But everything looks symmetrical in her sinuses, nothing abnormal. You know, if something looked abnormal, you could refer her to an ENT, or you could possibly have it read by a radiologist.
So for a coronal view, you're mostly focusing on the sinuses?
No, it's kind of like when you're reading a pan, you got to do it methodically.
Okay.
So now I'm looking at the teeth, and you can see she has a palatal or you know, like a little tori right here. No big deal. Doesn't look like much of a bump in the tissue. Yeah, so now I'll go back and forth a lot, so I'm just looking at the apices of the teeth, just looking for anything abnormal or any defects, and I don't see anything. So now you can do the same thing this way. So here I'm just looking at the root tips. Nothing's really standing out. Her incisive canal looks normal, healthy. I don't see any defects. I'm going to reset the orientation. Now this view is another good view. So I'm just going to start at the bottom, and so you can see this blue line here going up, or here you can see this blue line. I don't typically have these planes turned on, but for demonstration purposes, I am showing you. Here we can see on the right side, we can see what right here?
You can see the mental foramen.
Correct. And you see it's not shown on the left side just because of the angle. But if we come up a little bit right there, you can see it.
Yeah, awesome.
Okay, great. So also, I'm just looking at the apices of the roots. I don't see any periapical radiolucency. I can see some
How do you know that?
So here, this is a good case for looking, but not like a great case for, you know, finding a problem.
Mm-hmm.
But that's okay. So like right here, there's bone all the way up against the root tips. In here, and here, and here. It's just, you can visualize bone all the way right up to the root. Whereas if there was a periapical radiolucency, it would be dark or less dense.
Okay.
Like here, you have something called Hounsfield units. It's a measure of density.
Mm-hmm.
So like your most dense, like here in the cortical bone of the mandible is almost 1900 Hounsfield units. Here in the tissue is -68.
Okay.
Like here, like inside the tooth, 1623, and then the bone around it pretty darn dense. Whereas if it were here's kind of a less dense spot right here, to 325, but then right here on the midline, like the suture between the left and right side, 1566, so very dense. Okay, so yep, so we're scrolling up. Sometimes you can visualize decay. It's not the best for diagnosing decay, but sometimes, like right here, we're on the maxillary, and she's had some fillings done. But so sometimes when you, and then let's see, I'm gonna right click on the upper and level that out a little bit, so that I'm hitting the premolars at the same time.
Okay.
But sometimes if you have an interproximal cavity right here, sometimes you can go in the axial view and just see where it is, because you know, sometimes on a premolar it'll be more toward the lingual or more toward the buccal. You can get an idea of size. Does that make sense?
Yes.
Okay, so another thing, if you were trying to look at a specific tooth, and this is how I'd want an assistant to set this up. So let's say we're trying to look at tooth number 13. So I'm going to left click on the coronal view, slide it over until I can see tooth number 13. Then I'm going to go over to the sagittal view, drag it back to get 13 in the view. And then I'm going to right click and rotate. And then I'm going to do the same thing here. So, and then I'm going to go down to the axial view, right click and rotate like this. What I want when I'm viewing an individual tooth like this is I want it to look like a bullseye, like a target right on the tooth. I want the coronal plane splitting the tooth. I want the axial plane, I want the coronal splitting the tooth, the sagittal splitting the tooth, and I want the axial preferably to look like a target, like with the coronal going straight buccal lingual and the sagittal going straight mesial distal, just like a bullseye. Then if you do that, you can analyze the tooth. If you're about to start root canal treatment and you want a measurement from the, sorry, I didn't describe that. Okay, so one thing you can do once you get it lined up, oh, that changed. We're going to go back to the view with the hand here, the move rotate volume. So I'm going to right click and you can spin. This works well with an implant too. So you can see it spinning around the coronal up there. You see? So it's a really good way to just evaluate what's going on with the tooth or the implant. So does that make sense?
It does.
Okay, so if we want to measure this tooth, let's say we want to measure from the cusp to the apex. We're going to go over to annotation, measure length. We're going to do that. We're going to come here, left click, hold down, go up to the apex. So it's about 20.6. You know, we're going to go in and I would reduce the occlusal before I start my root canal, so it's somewhat of a guide. I'm going to do a 2 millimeter reduction from the, let's see, I'm going to go over here. I'm going to delete this. So we're going to go to annotations, check that.
Wait, say that again.
Under annotate, object browser over here. Then we're going to, let's see, give me 1 second. see. I'm gonna pause this for 1 sec. Okay, so yep. So we're gonna go over here to annotations on the right side and delete that. We're gonna verify yes, we do want to delete it. So we're gonna do another measurement here. This time we're gonna measure to the central groove there. So it's 19. So then if I was doing like a 2 millimeter reduction before I started endo, I'd know it'd be about 17.
Okay.
Does that make sense?
It does.
Okay, so we'll go ahead and delete that. And so a lot of times when you're getting ready to, now if it's a number 6, you're not going to reduce it because you're probably not going to put a crown. So you would just measure to the incisal.
Okay.
Oftentimes the team members already have it in this orientation with the measurement for you before you start the root canal treatment. Does that make sense?
Makes sense.
Yeah, that's the dream, right? That okay, so now this menu here, I don't use it. It defaults back to toggle zoom mode for mouse scroll wheel. It defaults back to that sometimes after I turn the measurement off, but I prefer using this one. This is the reset orientation. We use that often because it's going to take you back to a baseline. This, you show or hide annotation overlay. So it's going to take away those lines. It will take away any planned implants, measurements, anything you put on the screen.
Okay.
But it's this, we don't really mess with that. If you want to learn about it, it's great. Crop volume for 3D render, I don't really mess with that. You can learn about it if you need to. Noise filter, export view to other tabs. Let's see. You know what? Let's click this one and see. Nope. I'm not sure. I don't really use that one. Okay, so volume reslicer. Save seconds. I'd honestly have to look back over that one. I can't say. I'm just going to go over the ones that I do use. So annotation, the measuring length, I do that. Which I just showed you. An angle. You know, you can. Let's see. Measure an angle like that. I don't typically use that, but you know, if you have an application where you want to, that's totally fine. You can add text annotations. You can do squares, circles. I do some of that. And
when you do your implants, or is there another?
You know, well, I'll give you an example of a time. I don't really use them currently, but like right here, if I'm so right here, here's the hamulus, the tip of the hamulus right here. So I'm going to make a circle on that. So then that circle's floating right here. So then it's just giving me a reference point. So if I was placing a pterygoid implant here, I use the hamulus as a reference point. I did that for a while. I made these annotations, but then, you know, I did it enough. Now I just look at it and I can gather my point of reference in my mind. Okay. So they're just available. You know, if you want to use them, you can. But it's and then you can mess with these. You know, this one changes the brightness. You know, again, you float over it, it gives you the name of it. 3D rendering contrast. So yeah, these just kind of change the way it looks.
Okay.
This one gives it, let's see, what is this one called? Rendering transparency. So sometimes if you place an implant, you can kind of make it look cool with these, but all these are just communication tools. Let's see. Alright, so that's pretty much an overlay of the Explorer view. Let's see, you can import a DICOM file here. I don't really use the stitching. You can take a snapshot. Let's see. There you go. There's a snapshot of this whole view. Okay. And you can export that. You can also do the, there's a camera, so you can just snapshot just this view rather than the whole setup. That's a good way to communicate with specialists and other dentists and sometimes patients. Okay, so now we're going to go, I don't really use panoramic view. I'm going to go to implant view. I don't really use TMJ or superimpose or surface. So really Explorer and implants are the ones that I typically use. Okay. So Oftentimes when you go into Panoramic, you can select Auto Fit over here on the right under Panoramic, because here's the Panoramic right here. You don't have to go to the Panoramic view. And then you can click Focus. A lot of times that gets most things in view. So if you wanted to adjust the panoramic curve, you scroll up here, about right here in the maxilla, and you can do a couple things. Under Panoramic, you can select Edit Panoramic Curve, and then you can grab these little dots and you can move them to bring a specific, basically it's bringing, that's the center of your focus. Does that make sense? Okay. Or you can do Draw Panoramic Curve, which is sometimes faster because you just draw it where you want it.
Okay.
Or like if you want to do the mandible, if you want to look specifically at the mandible, you just click on that again. And after you've done this, you can select Edit Panoramic Curve if you want to move it around.
Okay.
Does that make sense?
It does.
So here, you see how the teeth are out of focus? You can go to Edit Panoramic Curve and just grab these dots, move them into where the teeth are. Let's see, focus. And then I click Focus and kind of clears it up. Now, this view, that's for mostly the panoramic curve. Why I move it is because when I go down to these slices down here. Now, on most views, I haven't figured out how to turn this back on, but there's 5 red lines. On mine, there's 1. I'm not sure how to turn it back on, but when you slide around like this, and let's say you stop here, or you stop on the foramen. So here's the foramen. This side is going back, so in its increments of about 10 millimeters. So here, if we, let's say we go under annotation and we want to draw the nerve, we can click Draw Nerve. We just click outside the foramen, click in there, and then here it's not really clear where the canal is. So what I do is I grab it like this and just slide. Can you see it? So I'm watching it. I think it's about right here. And that looks pretty good on the, over there. Oh, there it is right there. And then sometimes it's really well demarcated, so you can just go click, click like this. Let's see, oh, there it is. Okay, and then what you can do is, I may be a little off, but it's still looking pretty good. Okay, so what you can do is click here in the gray. Not on the slider, but it'll jump one view.
That's cool.
So then you can just, and then sometimes if you can see it here, you can do it like this, but then that doesn't get it right, like buccal lingual usually. So then you can go to Edit Panoramic Curve, and you can click on the nerve, and then as you go back, actually it ended up looking pretty good. But then like right here, if that's a little bit outside and you want to move it, you just drag it down. Okay. And then we'll click off of that, and then we'll click back on the rotate volume. Okay, so this is, you want to trace the nerve. Let's say you're putting an implant at number 30. You know, you want to know where the nerve is. I mean, a lot of times you can just visualize it by scrolling, but if you put it in there, you can set boundaries for, like, if you place an implant, how far away it is. Okay. So in general, on this view, it's a good view for just, let's say you are evaluating for an extraction, and you could scroll through like this, and I'm watching the center section, and I'm looking, okay, where's the nerve in relation to this wisdom tooth? Or let's say you're taking out 31 and you're looking, okay, I see the nerve slightly to the buccal right at the apex. So it's a good way to, how you can see that bottom view, how I'm just scrolling through everything. So when you want that view, it's, as we're scrolling through, that's somewhat easier to look at it in this way than going in Explorer view and trying to manipulate all 4 views. Okay. Does that make sense? So I use this a lot when I'm planning particularly like larger implant procedures, like I'll scroll through and I'll be looking at the quality and quantity of bone as I go around. Does that make sense?
It does.
Yep. And so if you want to plan an implant, let's say you're going to take out number 19, you're just looking at it for the future, go to implant, click on implant library. Okay, I'm going to run through how to put an implant in here and then we'll wrap it up. Okay, so usually Zimmer, I go to Zimmer just because the measurements are pretty close to what we use, but you could use other implant brands, but usually I just go to Zimmer. Let's say we're going to place a 4/7 by 10 millimeter implant. I'm going to select that. You can set default if you're going to do multiple ones of that. You can click properties if you want to change those. So we're going to add to plan, you know, and there's other buttons here, but I won't go through every single one. And so here, you just bring your implant in. It's always going to give it to you with the in this position. So if you're in the maxilla, you have to click right click and click flip.
Okay.
But we don't need to do that. Let's see. So, and then we got a little warning because we're close to the nerve. So you can set those parameters of like how far you want it to be from the nerve before it gives you a warning. Okay, so you can grab it here and move it like this. You can move the top, or you can grab the body of the implant and bodily move it. You can click on it over here. If you hold Control and Shift, you can move it around on that model, which I didn't. I was having some trouble playing zygomatic implants in this software, but then once I called the sales rep and I thought it was more complicated, and he's like, oh, just click and drag over here, just like, or hold Control Shift and do this. Well, there's nowhere to tell you that. You know, so I was very thankful for that conversation. It made my life much easier. Yeah, so you can right click, you can copy this implant. So if you're going to do another one, you can do it like this. Now if you place one on the panoramic view like that, then it's going to be not necessarily correct in the buccal lingual orientation, so you have to scroll around and move it. Then they're going to be down here under Object Browser with the measurements. So if we click there, it'll highlight that one, and then we can just click on the trash can and delete those. Let's see. Yeah, so we can, you know, as we come up with examples of problems, we can look at that together.
As far as like caries detection, what view are you using for that?
I don't really do caries detection so much. Like the patient you were talking about, I mean, she needs bite wings, or she needs. She
has bite wings.
Oh, okay.
Yeah.
Well, truly to diagnose, you'd need an FMX. Like 3D X-rays for decay is not great.
Okay.
You know, it's possible. It has to be, you know, pretty decent sized decay or missing tooth structure to be able to visualize it, but it's not really a generally accepted way to diagnose, particularly like interproximal or buccal decay. Now, can you see it? Yes, like number 19, if she had a big buccal decay, you would see a dark spot. Yeah, but in general, yeah, more of the 2D X-rays for caries detection.
Okay.
Cool.
Cool.
What other questions?
We have bite wings, but she had a lot of anterior decay.
Okay.
That we don't have on bite wings, but I mean, I could feel, you know.
Oh yeah, so you'll need some. You'll definitely need X-rays of that. What do you? Well, we'll try to look at them. What other questions do you have?
As far as this, I'm good. Are you gonna send this to me? And
yeah.
How did you record it?
Oh, with the software. It's Camtasia. It's a software on the computer.
Okay. Yeah.
Yeah. So we're gonna orient on, let's say. Yeah, I mean, that's about the best you can do. Look at it like this, and you know, it doesn't look like a huge lesion on this tooth. So, yeah, perfect. All right, yeah, I'll send this to you, and that's some good basics.
Awesome. Thank you so much.
You're welcome.
Appreciate it.